My name is Dr. Lynn Feun. I'm a professor of medicine in the Department of Medicine. My talk will deal with treatment of melanoma. I will talk about the immunotherapy agents, how they have produced prolonged duration of response, which immunotherapy drugs have shown the most activity. I will talk about how we can treat brain metastasis for melanoma, how both immunotherapy drugs and targeted therapy can be effective in treating patients with metastatic brain tumors. I'll also talk about the newer agents used for NRAS mutant melanoma using one of the newer agents. And also talk about the new oncolytic viral therapy for melanoma. There are a number of immunotherapy agents on the market, and the anti-PD-1 drugs have shown more activity than the anti-CTLA-4 antibodies. And I'll discuss the results of a 3-year study looking at the duration of response. I'll also be discussing how we can treat patients with metastatic melanoma to the brain, how our newer immunotherapy agents have shown activity and produced some durable responses. I'll also talk about how we can use the new BRAF and MEK inhibitors to treat metastatic melanoma to the brain. As you know, metastasis to the brain is one of the most difficult problems in oncology, and these newer agents have shown activity and offers an alternative to the standard radiation therapy. The conclusions are that the newer immunotherapy agents such as nivolumab and ipilimumab is active in patients with brain metastasis, and patients with BRAF positive tumors can respond to BRAF and MEK inhibitors when they metastasize to the brain. It's not as effective as extracranial disease, but there are responses reported when these agents are used for patients with brain metastasis. Well, I'd like to emphasize that melanoma is one of the first tumors where immunotherapy has shown promise, and now with newer agents, we've changed the prognosis for many patients. And with the new targeted therapies, we can produce prolonged survival and duration of responses. So I think this is encouraging and promising patients who have this bad cancer. The future looks bright in terms of treatment for solid tumors, as immunotherapy has shown to be a powerful tool in treating cancers and adds to the armamentarium that we have available for treat these patients.